Hi, it's Dr. S, your student nurse success coach. I am back to check in, see how your week has been. Hopefully you had a great week at clinical. I don't know if maybe this week is your first week to actually have clinicals, or maybe you've only had one or two, so I'm excited to get some feedback on how things have been going, which is where we're going to start tonight. I polled some of my students from last semester and asked them what would they like to hear about, or what do they think would be some good things to start out talking about. And they all agreed tips for your first clinical experience, or even if you're having clinicals or you've had them before, your second, third semester, just some things that may make it a little bit better of an experience and hopefully learn some things along the way. So that's what we're going to start with. First thing I want to say is be prepared for clinical. Look at it as a pre-workout, okay? You don't need to be up all night the night before at the Wine Wednesday or Thirsty Thursday or date night or anything like that. You need to be in the bed at a decent hour because you're going to probably have to get up early. You may even have to commute. You're going to be stressed, so you're going to be burning more calories. And a lot of students used to tell me, I can't eat that early. And I said, well, you better bring something with you and eat along the way because your body has to have fuel. You're going to be physically exerting yourself. You're going to be in rooms that are hot and unpleasant smells. These patients, all of them are not going to be tiny little people. Some of them are going to be very large, heavy patients that you have to physically exert yourself. You're going to be on your feet doing work that you're not accustomed to, and it's going to take its toll on you. And you're going to be miserable. I'm just going to tell you. I've had at least one student every semester either full on pass out on me or they almost did. Thankfully, I'm aware of it now that it's going to happen. And when I see they're going a wrong direction, I usually get them out of there because I do not want anyone to pass out, hit their head, all the things. So you will get weak, you will get sick if you don't prepare ahead of time. So make that a priority. Excuse me. The next thing I want to tell you is go all in. Make clinical the best part of your nursing education. I feel like sometimes it gets the least amount of effort from the student because there are so many other tests that you have to study for. A lot of people have either ATI or Kaplan products that they're using in conjunction with their theory classes, and there's a lot of work to do, and I understand that. But this is your time to really go all in and connect the dots of the things that you're learning in the classroom, the skills that you've been checked off on in the skills lab, your simulation labs, all those things. This is your time to try on a real live person. And if you will make the most of it, it can be the best part of your nursing experience. And it will go a lot better for you. I promise you. There is a lot of learning to be done in the clinical environment, and if you're not at your best, you're going to miss it. And a lot of times students say, hey, it helped me on the test. I had a question, we had it on this patient, it made sense to me, I understood it. So go all in, do your very best. Just be prepared. There's going to be a lot of unpleasant things you have to see and do. Make sure that you're maintaining professionalism at all times, okay? Especially if the patient is understanding what you're saying and what you're doing. Always treat people with respect. All right, be confident. Go into your patient's room, look them in the eye and say, hello, my name is Beth. I'm your student nurse today, and I'm going to be taking care of you. I'm going to start off by taking your vital signs, and after that, I'm going to listen to your heart and lungs and look at your skin, and then we'll get ready for breakfast to come. After breakfast, we're going to get our bath, and if you want to do a shampoo cap or anything like that, just let me know. I'll get all those things ready. Now, that patient has to have those things done. So it's not like you are imposing on them or you're assaulting them or something. You are doing exactly what their nurse would be doing, okay? So it's not anything they shouldn't be expecting. And if you will go in there acting like a level-headed, professional, mature, young adult, they will appreciate that and they will be glad for you to be there. If you will go ahead and start that now, that will that will help you so much, especially when you're getting into more difficult situations in clinical, having to deal with difficult people. Not all patients are sweet little grandmothers and granddaddies, I'll just tell you, okay? So if you've already got that confidence factor nailed down, then you'll be able to move through to even harder things. Please don't come to your nursing instructor and say, they're asleep, I don't really want to bother them, or they didn't really act like they wanted me to give them a bath, or they've got family right now, I think I'll wait. You know what that screams? That screams, I'm not really here to learn how to be a nurse. This is just a task that I've got to check off my list, okay? I promise you, that's what your clinical instructor is going to think. If you don't get this under your hat now, you're going to struggle, okay? Everything in the hospital works on a schedule, and you have to start your shift off getting your vital signs. This is after you've gotten a report and gotten yourself organized. You go in your patient's room, you prioritize which patient you're going to see first. Now, as a student, you've usually got one patient, which is going to be great, but you're going to go in the room, you're going to get their vitals, you're going to go ahead and get an assessment. Now, when you go in that room, a lot of the rooms are going to be a wreck. The patient's probably going to be extremely sick. There's going to be a lot going on, and you're going to be on sensory overload. And your first thought is to shrink back and be afraid. But what I want you to do is go in there and think, I'm going to take this one piece at a time. Every patient gets the same routine regardless of if they're swinging from the chandelier or if they're in the floor or, you know, crouched up on the counter or sleeping in the bed like a baby. It all starts with you introduce yourself, you show them that you're gentle, that they're safe with you, you get those vital signs, and you do a really good assessment. An assessment is not just listening in the anatomical locations, it's pulling that gown up. Lift up that gown. You can do it in a very discreet, respectful way, but a lot of times you won't know that they have a huge gaping open incision or an ostomy or you know, a chest tube or something underneath there. You get in the habit of really looking at that patient, looking to see what all's going on with them. You also need to know how did they go to the bathroom. If they have no legs, then chances are they've either got some form of a ostomy, a urostomy, a catheter, or they're incontinent, or they have control and they use the urinal or the bedpan. Like, know how they go to the bathroom. Know, can they turn over by themselves? If they can't turn, then that means they're depending on you to turn them. Pick up those feet, look at the bottom of their heels. Do they have a big black wound on the bottom of their heel because no one lifted up their foot to look? Feel those pedal pulses. Do they have two legs? You know, all these things matter. And as you go in and start to talk to them, you can tell in a matter of a few minutes if they're alert and oriented or not. Okay, and that plays a huge part. Then start looking at all the things that are attached to them that they weren't born with, like an IV. Where's their IV? Is it a PICC line? Is it a saline lock? Is it a central line? Do they have a VAS cath for dialysis? Do they have an NG tube or a feeding tube or a PEG tube? Like all the things that are attached to them. And then what kind of airway do they have? Are they on room air? Are they on oxygen? Then trace it back to the flow meter and look and see what the oxygen is set at. All those things matter. And everyone has a different way of remembering what to do next. But if you have to take some kind of cheat sheet with you, I'm sure your clinical instructor has something. There might be something in your course to help remind you. All right, you start with neuro, you go down their airway, their respiratory, their heart sounds. Are they on the monitor? Go all the way down. Get a consistent rhythm of how you look to see what all's going on with that patient. And learn how to do a really good baseline assessment in a short amount of time, okay? Because you're not going to have time to do a head to toe like you learned how to do in the lab, okay? The importance of that was to make sure you understood how to do it and do it well. Not that you're going to be doing that kind of assessment on every patient, unless maybe you're in the ICU or something. So take your time, get your things done, do it in a timely manner. Don't look at the whole big picture. Start off every patient a little bit at a time. The next thing is be a team player, okay? Everyone can't be a leader, okay? We have to have leaders and we have to have team players. And what I mean by that is be willing to go help someone. If no one asks for help, you go ask them, do they need help? Go in other patients' rooms. If the call light goes off and you're standing at the desk because you have completed your task for the morning and they've asked for some water or the urinal or whatever, go down there and help them. All right, don't stand there and look around and think, oh, well, that's not my patient, I'm not going. They're all everyone's patients, so go and help them. Don't go above and beyond what is in your scope of responsibilities, okay? Make sure, if you're unsure, is this something that I can do, ask your instructor. Now, if you're helping a patient ambulate, you make sure that you have enough help until you know exactly what the patient's able to do. We don't want to cause any falls. We don't want to cause anyone to roll out of the bed or any injuries or anything like that. Make sure you have, especially if you're a smaller person, you're not that strong, this patient is, obviously heavier than you are, make sure you have enough help with you, okay? All right. So kind of know what the objective of the clinical setting is. If you're on a med-surg floor and usually the beginning of the semester, they give you the objectives of things that they want to see you accomplish, and make sure you understand those things and look for those opportunities to get those things done. Don't avoid doing a skill just because you're nervous, all right? It's never going to make you not nervous by avoiding it. The only way to overcome it is just to jump in and do it. Last semester, I had a student who we put a Foley catheter in a lady, and her hands were shaking so bad, I had to just put my hand on top of her. But it was very important that she break through that fear of it and just do it. And she would look up at me, and I just kept smiling and nodding my head because she was going to get it. I was not going to allow it not to go well. So if I had said, you're too nervous, go back to the room, we'll find someone else, she would have missed her opportunity to break through and do it. Once it was over, we had a little talk about it. She felt relieved that it was done, and she moved forward. And I'm hoping this semester she's not as nervous about performing tasks on patients, but everyone's nervous about something at some point. Just don't let it hinder your learning, okay? Now, the most important thing is patient privacy, patient confidentiality. Don't talk about patients outside of the clinical setting. Your instructors have told you that. I'm sure you know. But you would be surprised who is listening, who is watching, who is waiting to go and spread something that's not true. Always remember, people have their cell phones on, okay? And they're recording you. Please don't think that someone wouldn't do that, because they will. So always make sure you are on your utmost professional performance, and that you are treating everyone with dignity and respect. Now, something for the new graduates. I spoke with a previous student of mine who now precepts new graduates in the ICU, and she said that one of the biggest things that they face, not only in just learning to be a nurse outside of nursing school, is being overwhelmed with how much responsibility there is. Everyone communicates to them, and they're responsible for getting the information out to everyone else. For example, one doctor calls, wants to know, is the lab work back on patient in bed B? Yeah, the lab work's back, and this is what it is. Okay, well, let surgery know, because they're probably going to want to go ahead and take them to the OR. Or respiratory tells you, they're in distress. We changed their O2, we changed it to a mask or whatever, and then they leave it on you. And the nurse needs to relay that to the physician, get an order, investigate further, whatever. And that's on top of everything else that you have going on. That's a lot. That's overwhelming. And even as a seasoned nurse, I would get overwhelmed with the amount of responsibility. I felt like I was the central hub. Everything had to go through the nurse, and that's just always going to be that way. And The only way I can tell you to adjust to it is to just, if it means making a list of all the things that you have been told, and as soon as you get a chance, report it, mark it off, make your notes. But just know that's the part of priority of care that you had to learn in nursing school. You had to know when it was the appropriate time to put something on hold, to pick up the phone and make that call. Also ask for help. Your charge nurse is there for a reason, and he or she should be willing to help to get the job done and get the patients taken care of. All right? Don't try to be an island unto yourself, especially as a new graduate. Here's something else I always tell my students when it's our last few clinical days together. When you start out as a new graduate, there's going to be a nurse who has been a nurse forever. They're not going to be too happy about being with a new graduate. In fact, they probably look like the meanest, the crustiest, rustiest old grouch nurse that there is. They're not going to want to help you. But that's who you need to make friends with, because they know more than what you probably realize. All right? And if you let them know, I value your experience and I want to learn from you and I need your help, and I'm willing to turn around and help you back as well, which means I'll go down there with you and help you turn your patient. I'll, go to the lab and pick up your blood for you. Whatever you can do to make them know that you're not there to be a life sucker. You're there to be a part of the team and you want to learn and give safe patient care. You will win them over. Now, you're probably not going to change their personality, but they will be the ones there when something starts going south. And that's what you need. You need a trusted source of information that's going to not just, fluff and puff you and make you feel like you're the greatest person in the world, but you're going to have someone there that's going to be real with you and help you avoid a disaster coming, okay? Do not be afraid to reach out to that person. That's advice that I was given. That's advice that I followed. And I had to learn that it wasn't a personal thing, that you're working with all different kinds of personalities. So, excuse me. I hope that this was helpful. I would like to hear from you, hear how your clinical experiences are going. I would like to know what kind of patients you've been taking care of, things that you've learned, questions that you have, and know that I am here to coach you through. And until next week, have a great week and keep doing the best you can do. Bye.